Hi, I'm Steve G. Jones, clinical hypnotherapist. I want to tell you a little bit about myself before we get started. I have a bachelor's degree in psychology from the University of Florida, a master's degree in education from Armstrong Atlantic State University, and I'm working on a doctorate in education at Georgia Southern University. I am a certified clinical hypnotherapist, a member of both the American Board of Hypnotherapy and the National Guild of Hypnotists. I'm president of the American Alliance of Hypnotists. I'm the director of the Steve G. Jones School of Clinical Hypnotherapy. I'm also on the board of directors of the American Lung Association in Los Angeles. I have over 2 decades of experience in hypnotherapy. I currently live in Savannah, Georgia, but I see clients and teach classes worldwide. My client base consists largely of people who need to lose weight, stop smoking, or gain some sort of confidence. Other clients include sales teams interested in boosting motivation and increasing income, singles searching for love, insomniacs desiring proper sleep, just to name a few. When I travel to see clients and do hypnotherapy certification classes around the world, I go to such places as Tokyo, Japan, Barcelona, Spain, Paris, France, London, England, Montreal, Canada, Los Angeles, California, and New York, just to name a few. By the way, since you have an interest in hypnosis, perhaps you would be interested in becoming a certified clinical hypnotherapist. It's very easy to do. All you have to do is go to my website, stevegjones.com, and click on Hypnosis Classes at the top. You can either train in person or online. You will then be added to our worldwide directory, and you will receive a certificate. I was fortunate for several years to have an office in Beverly Hills, California, where I worked with such wonderful people as Tom Mankiewicz, the writer of Superman, Geraldine Saunders, the writer of The Love Boat. Recently, I was invited to be on The View with Barbara Walters and Whoopi Goldberg to talk about the powers of hypnosis. And with my over 20 years experience, I'm now happy to share with you techniques which I have both developed and learned about over the years, which I believe can help you improve your life. I encourage you to visit my website, stevegjones.com. There you'll find my life's work. Over 15 books on hypnotherapy, over 250 programming CDs which program your mind to achieve your goals in such areas as weight loss and motivation and stopping smoking. And of course, audiobooks like this one, where I'm talking with you and sharing in a very dynamic way the techniques you can use to make an improvement in your life and the way you do things. And the reason I'm telling you all this is not to impress you, but to impress upon you that your teacher, myself, is very capable, and I know what I'm talking about, and I'm happy to share this information with you. So rest assured you're in good hands, and let's have some fun as we now learn how to do certain techniques in a hypnotic way. I wish you well in your endeavors, and if I can be of further assistance in your journey, feel free to send an email to steve@stevegjones.com. Welcome to the program on social anxiety. I'm Steve G. Jones, clinical hypnotherapist, and I'm going to be your tour guide as we talk about relieving social anxiety. Now, keep in mind, if you've been diagnosed with any kind of anxiety, you need to first seek the care of a qualified medical professional. That means someone who's licensed, doctors, psychiatrists, psychologists, someone who's licensed to help you. However, if you want to learn about social anxiety and how hypnotherapy can help, well, this is going to be very informative to you. So these modules will help you learn about social anxiety and how hypnotherapy would approach it. First of all, social anxiety is irrational, and it's an excessive fear of social situations. Let's face it, we're all scared to some degree of some social situations. If you've never been afraid in any social situation, then you probably haven't exposed yourself to a vast array of social situations. Have you ever been at a meeting, for example, where you thought a fight was about to erupt? I was in a meeting recently, and it was a
It was an advisory board talking about some research to be conducted in hypnotherapy, and there was a disagreement among two of the professors involved. One said that the statistics should be done one way. One said they should be done another way. Well, I wasn't scared, but I was certainly elevated in my anxiety about the situation. I thought, oh, wait a minute, this could get out of hand. So I immediately was able to calm myself down, of course, because the fight did not involve me. But I was certainly at an elevated state of anxiety. I wasn't at my normal state of being calm and peaceful. It kind of went up a little bit, and then I got control of it, and it went back down. All of us have from time to time been involved in social situations that cause us to be anxious. What we're talking about when we talk about social anxiety is that irrational and excessive fear of social situations, the anxiety that causes you to be so concerned that perhaps you're avoiding situations that would actually benefit you. You know, if I had thought ahead of time that an argument might break out in that meeting, and if I had had social anxiety related to arguments, I may not have gone to that meeting. But as it turns out, I don't have social anxiety, so it didn't debilitate me. It didn't cause me to either not go to a meeting where there might have been a fight, nor did it cause me to walk out of the meeting while something was going on. I took it all in stride. Well, that's the way people without social anxiety will react to a social situation that's elevated a little bit. But if you're one of those people who has social anxiety, then you would avoid a situation like that or any number of situations that cause you to feel uneasy because of your social anxiety. Now, for some people, it's so intense that they just avoid going out altogether. I had a client one time when I had my Beverly Hills office, and she was the wife of an artist. And this artist stayed at home all the time, and he painted. Well, he went out sometimes and he did things in the outside world, but she didn't have to go out. She didn't have to work outside of the home. They didn't have any kids, and she stayed at home all day. Well, he started to become a little concerned when a year had passed and she had never left the house. So I was called in, and of course, this was not an office visit. I had to go to them, so I made an exception. I went to them, and I worked with her to get her out of the house. But what happened was she had developed social anxiety because one time, just one time, she and her husband were out at an art show, and some lady was overheard. She overheard some lady talking about her husband's work and putting it down, saying his art was no good, it was overpriced, and so forth and so on. That was enough to make her fearful about going outside. Now I suspected, and I later on found this out to be true, that there were other factors contributing to that. Let's face it, if we go out and we hear something bad, we're probably not going to stay inside for a year just because of that. This was a culmination of a lot of things she had been hearing over the years. A lot of things her parents had told her as a child, a lot of things her parents had told her about her husband that were negative, and this was it. This was the straw that broke the camel's back and caused her to go inside for a year. So generally it's not deadly, but it will interfere severely with the quality of your life. Think about all of the things that she missed out on during that year. It often arises from a fear of being watched, judged, and or criticized by others. So she had been criticized all her life by her mother. And when she got married, and even before she got married, her mother then turned that criticism onto her husband. And then she thought the outside world didn't like her husband either because this lady was talking bad about art. Well, I saw the art, and I wasn't too impressed myself, but I certainly didn't say anything bad. It's normal for people to be polarized when it comes to art, either like it a lot or not like it. In fact, I think that's a sign of a great artist. They cause a strong reaction. You either like their stuff a lot, you're a fan, or you hate it, and you don't want to see it anymore. So it's normal. She took that to be the final blow. That's it. She had been criticized. She had heard about him being criticized, and that was it. So it arises from a fear of being watched, judged, and or criticized by others. It can affect self-esteem, and it can increase your anxiety, which can lead to other complications such as panic attacks. So let me tell you that a panic attack is no fun. And you may think Steve G. Jones, the hypnotherapist, would never have a panic attack because he's so calm during everything. Well, everyone has their tipping point, and I've had mine. So let me tell you a brief story about me having a panic attack. You would think that I could calm myself with hypnosis, but I was actually hypnotizing myself. I guess over the years, I've become so suggestible to hypnosis. I've opened my mind up so much to suggestion that I was actually hypnotizing myself. And let me tell you the story about a panic attack. Now, my panic attack didn't come from necessarily feeling bad about myself or the normal route that social anxiety would lead to a panic attack. But I want to illustrate for you what a panic attack is, because unless you get under control this thing called social anxiety, this is what could happen. Now, don't listen to this the way that I went through the scenario. I was listening to the symptoms, and I was making myself worse by listening to the symptoms. I'm just telling you what happened to me. This is not anything related to you. You'll understand what I mean as I tell the story. So there I was in my home, and in a couple days, I had to take a plane flight to do a TV show where I had to go into a haunted house. And I had to hypnotize some people in the haunted house. Now, whether or not you believe in hauntings, that's not the issue here. I was a little nervous about going into what was at least called a haunted house. They were going to fly me out to Virginia, drive me to the quote-unquote haunted house, and I was going to hypnotize some people in there. Well, I didn't have previously an idea about whether I believe in ghosts or not. Some people do believe in them, some people don't. I just thought maybe they exist. I don't really care. It's kind of like UFOs. Maybe they're out there, who knows. But apparently, in the back of my mind was this anxiety related to that. First of all, I had to fly there. Second of all, I had to perform my job there. I had to hypnotize these people to have them remember the experiences of the hauntings and remember their dreams related to that so that they could get some relief from what they were going through. And third, this was what was called a haunted house. Well, I didn't know what that meant. I didn't know if that meant things were flying around or floating through the air, or if it meant that people just thought it was haunted. I didn't know what any of that meant. So I started to get a little anxious about it. I didn't even realize that was happening. And so what happened was a couple nights before I had to fly out, I was going to bed, and it was probably around 11 at night. And as I was going to bed, I noticed that my breathing was a little faster than usual, and I felt a little dizzy. And I just thought, wow, it's been a long day. I've had a few patients today, and I'll just go ahead and relax, and everything will be good in the morning. Well, as I was lying down in bed, my mind just kept rushing. Wait a minute now. I'm over 40 years old. I'm possibly a candidate for a heart attack because my dad had had a heart attack, and I feel some physiological symptoms. Well, here's the mistake I made, and I recommend that you don't make this mistake. If you think you're having a panic attack, just call 911. Just do that or call your doctor or whoever's available. What I did was I started doing some research online. I got online and I got on Google and I typed in panic attacks, and it gave me a list of symptoms related to panic attacks. As I read the symptoms, you know what happened. I developed each one of those symptoms. Increased breathing, well, I already had that. Shortness of breath, I was already getting that. Dizziness, I already had that. I think the next one was impending feeling of doom or something like that it listed. And sure enough, that came next. And so by the time I got up and started walking from the computer to my bedroom, I was in a much worse state. Rather than calming myself down, these symptoms increased. And this is actually an effect that's known. Medical students, for example, many times will learn about a new disease and they'll think they have that new disease because they have 3 out of 5 of the symptoms, or they think they do. So sure enough, they diagnose themselves with that disease. It's common for people to think that they have something when they know just enough to be dangerous. What happened next was I called a good friend of mine, and we spoke on the phone, and I said, I think I'm having a heart attack. And he said, you got to be kidding me. And I said, no, I'm pretty sure I'm having a heart attack. So he said, well, you need to call 911. I said, that's a good idea. So I called 911, and I went out to my front doorstep. I went outside the front door, and I was lying down on the front doorstep because I thought in my mind, in my lack of logical thinking, of course, maybe this was logical, who knows, but I thought that if I passed out, at least when they show up, they can find me and they don't have to come in the house and look for me because it's a big house. I don't want them to have to look around and potentially not even find me. So I was lying right there, right in front of the door where they could find me. Sure enough, they showed up. They put put me in the ambulance. They asked me a few questions. They asked me if I had been drinking or anything else. I said no. They asked me if I had a history of this. I said no. They asked me what made me think I was having a heart attack, because that's what I called 911 saying, I think I'm having a heart attack. And I said, well, I just have these symptoms. And they took me there and checked me out. And maybe 3 to 5 hours later, I got out, and I think the sun was coming up at that time. And every single test came back negative. They did a chest x-ray. They did some blood tests. They took my blood pressure. They did a number of things. Everything showed that I was perfectly healthy. What had happened? I had psyched myself out. I had hypnotized myself in a negative way. I had convinced myself that not only was I having a panic attack, that I was having a heart attack. It seemed logical to me. My dad had had several heart attacks. So why am I pointing all this out to you? Why am I taking you through my story of what turned out to be a panic attack? Why am I taking you through the story? Because I want you to understand the severity of what you're dealing with. If you have social anxiety, I said a little while ago that it could lead to complications such as panic attacks. I do not want you to go through what I went through. I honestly thought my life was going to end. I thought I was going to have a heart attack and die. That's what I thought. That's what I felt in that moment. That's why I called 911. That's why I went to the emergency room. If you have social anxiety, you need to get treatment for that. Now, I'm going to offer you in this program what hypnotherapy says about social anxiety, but realize if you feel that you need something beyond that, seek the help of a medical professional, a licensed medical professional, to get this under control before it leads to something like that. And if you have already had a panic attack, then you know what I'm talking about. You need to take steps to make sure that's not going to happen again. And there are simple steps you can take to make sure that you're reducing your stress and dealing with it in the appropriate ways. So people who have social anxiety often experience an anticipatory anxiety days in advance of the event. Just like I had a panic attack days in advance of the event, people who have social anxiety often suffer an anticipatory anxiety. It could be something fairly mild, just something that's kind of eating away at you. Oh, I've got to do that public speech. Oh, I've got to do something in public. I've got to do this. I've got to do that. I've got to go into that new class. I've got to teach that class. I've got to give a speech. Whatever it is that you have to do, you may experience anticipatory anxiety days in advance of that event. So not even being in the event, you can still suffer the consequences of having this. So people who suffer from this don't know it's irrational. They don't know that it's something that doesn't make any sense, yet that logical part of their brain is kind of suspended and they can't control or overcome it in that moment. At least they don't think they can. Social anxiety is the most common anxiety disorder. Approximately 19.2 million Americans suffer from this. Social anxiety can surface at any time, but usually it happens around adolescence or early childhood. It is more common in women than in men. It's believed to be caused biologically by an imbalance of serotonin in the brain. Now, serotonin is a chemical derived from the amino acid tryptophan and widely distributed in tissues. It acts as a neurotransmitter, it constricts blood vessels at injury sites, and it may affect emotional states. So when you get an imbalance of something so important as serotonin, it can cause problems. Now, I say it's believed to be caused by that because it's not conclusive that it is. That's just a suspect, serotonin. In addition to this, or instead of this, it may be caused by past experiences with traumatic events, personally or observed through others. So you can actually see something happen to someone and be traumatized by that. So this is something that's diagnosed by a medical health professional. It's diagnosed by a physical exam of the body and by taking a family history. So if you think you have social anxiety, it doesn't mean you have it. If someone told you have it, it doesn't mean you have it, unless it's been diagnosed by a medical healthcare professional. And believe it or not, this may be interesting, there's no specific exam available for diagnosis. So how do people know that they have it? Well, the symptoms, as my research indicates, are distorted thinking in social situations, paranoia, inability or difficulty and discomfort in eating, drinking, working, writing, or doing anything like that in front of other people. So, along with that comes inability or difficulty and discomfort in social situations such as being in a bar, being in a restaurant, being in school, being in work. So, as you can see, social anxiety can affect every part of your life, and it can result in avoidance of social situations. So, imagine having social anxiety and not going to school, not going to work. Why would you let that go on? There's no need to suffer like that. Physical symptoms include confusion, heart rate increase, sweating, shaking, blushing, muscle tension, nausea, diarrhea. The most common reason people have social anxiety, can you guess? Fear of public speaking. Perhaps you've heard of that the number one fear is a fear of public speaking. It's not bungee jumping or airplanes or tall buildings or spiders or snakes or anything. It's fear of public speaking. I'm doing a television show in a couple days, another one, about spiders, helping people overcome the fear of spiders. And in that television show, we're actually using tarantulas. And we're not using poisonous tarantulas, but they are scary-looking tarantulas to make the point that if you're really no longer afraid of a spider, you'll be able to let the spider crawl on your arm. So it's fascinating to me that more people are afraid of talking in front of a group than are afraid of a big, hairy, creepy-looking tarantula crawling on their arm. Can you imagine that? That it's scarier for people to get up and talk to other human beings than it is for this scary-looking insect to crawl on you. Most people would choose the tarantula crawling on them as opposed to getting up and talking in front of people. Can you imagine that? Maybe you can. Maybe you can. Maybe you're one of those people who feels that way. For me, it's just mind-boggling that someone would choose that. But that is a fact. The number one fear above anything else is the fear of public speaking. All right, let's take a little break, and I want to make sure that you're with me, that you're paying attention and that you're learning something. So what I want you to do right now is, if you're driving and you can pull over, go ahead and do that. If you're not driving, then you can definitely do this. You can take out a piece of paper and you can write down 5 things that you've learned so far from what I've said. 5 things that resonated with you. Now, I want you to keep in mind, they don't even have to be 5 things that I said. Maybe you got some good ideas from what I said. Maybe I said something and your brain took it and blew it up 1,000,000 times and came up with all kinds of wonderful, amazing possibilities based on what I said. If that's the case, then feel free to write that down. I just want you to write down 5 things, whether they came from me or they're just thoughts that came in your head. 5 things that have come to you so far, either from me saying them or from you thinking them, as a result of listening to this program so far. So as I'm silent, I'm going to give you ample time now. I want you to write down 5 things, 5 thoughts that you have as a result of listening to this program so far. Do this now. Okay, do you have your 5 things? If not, go ahead and finish them up. 5 things, write them down. So I'm going to move forward now. Let's take those 5 things that you have written down, and I want you to elaborate on them. For example, if you have an insight number 1, that I should change blank about myself, whatever it may be, I want you to elaborate on that. Whatever you've written down for point number 1, something that's come to you during listening to this program, I want you to elaborate on that now as I'm silent. Good. And now I want you to take point number 2 and elaborate on that. What was the second point that you wrote down, and how can you enhance this idea? I want you to make it real for yourself, because I want you to have, after you finish this program, something you can use. So on point number 2, elaborate on it. Consider what you wrote down as point number 2, the foundation. Now build a house on it. Go ahead and write down something now as I'm silent. Good. Now you're getting some momentum. Now for point 3. Point number 3 that you wrote down, something that came to you as you listened to this program. I want you to elaborate on point number 3 as I'm silent. Good. Now take point number 4, the fourth point that you wrote down, something that came to you while you're listening to this program. I want you to elaborate on point number 4 as I'm silent. Great. Last but not least, point number 5. Take point number 5 and elaborate on it as I'm silent. Good. So now you have something that you can take with you after this program. You have those 5 points that you elaborated on, and you can use them after this program's over. So let's continue on with the information now.